Hey, this is Dr. Tom Rogers at Performance Medicine with your weekly episode podcast of the Common Sense MD. That stands for medical doctor. I try to bring you some relevant information about your health care and how to approach it. Many different topics we've covered over the years, and today I want to be talking about a couple things that are very important to you and to me. One is fatty liver disease. We're talking about non-alcoholic fatty liver disease. Very common disease. I see it in the office almost every day because I treat a lot of obesity. And of course, obesity is why you get fatty liver disease for the most part. Alcoholic cirrhosis is the most common cause of liver cirrhosis or scarring, and then hepatitis. And then very close to that is just a fatty liver. You've probably heard that term many times. Traditionally, the standard treatment for fatty liver is something we do every day at Performance Medicine, try to get people to lose weight, to get leaner through diet and exercise. That's the traditional way, and that's still the number one way. But today I'm going to introduce you to a different additive way that can treat non-alcoholic fatty liver disease. And that is one of my favorite things, coffee, which I have right here. Now, I do prefer organic coffee because every coffee is not the same. I prefer it to be mold-free and organic. Coffee really has more antioxidants than almost anything you can consume. And, you know, there's controversy. Is coffee good for you? Is it bad for you? Well, it turns out it's very good for you in many ways, especially with fatty liver disease. Now, what happens with fatty liver disease is first of all, let me explain what your liver does. Your liver, it helps in your metabolism. It aids in your digestion. It's a detoxifier. That's the main thing that we talk about when we talk about liver, is detoxifying your body from all the toxins that we're exposed to, especially in the things we eat. Toxins are generally stored in fat, thereby fatty liver. That's those liver deposits you can see on your liver scan or fat that's full of toxins. The other thing that your liver does, it aids in your circulation. It's very important in that. So, you know, without your liver, you can't live. And it's a slow, miserable death if you get cirrhosis. You know, we've all seen a lot of alcoholic cirrhosis. It's a painful way to go. It's usually a long-term thing. So is fatty liver cirrhosis. But you have, a lot of times you get the fatty deposits, you get scarring, you get fibrosis, which is severe scarring. Then you get cirrhosis, which is in the end fatal. And it's a terrible way to go. If you've ever seen anybody in the hospital, I used to take care of them all the time when I did hospital work. They turn yellow, they itch all the time, and they die. But it's a long, slow, painful death. So you need to lose weight and get lean. And also you need to drink coffee. Now, we really don't know if it's the caffeine in coffee or the polyphenols or what it is that has that benefit, but most people think it's the coffee bean. The reason I'm talking to you about this is because a huge study, a meta-analysis, came out of Duke University. Now, meta-analysis means a bunch of different studies that came together. In this case, it was 18 different studies. It all showed the same result, that when you drink coffee, and that means 2 to 3 up to 5 cups a day, that the rate of fatty liver really goes down. I mean, whether you lose weight, stop drinking alcohol, remove toxins from your body, drinking coffee is good for your liver. I'm going to mention a few other things that it's good for too in a minute, but I mean, just think of that. It decreases even a 7 to 10% weight loss just by losing weight alone, which is the main thing we try to emphasize, decreases your fatty liver by 60 to 90%. And when you add coffee to it, that's another at least 40% reduction. So coffee's actually good for you. You know, I wish I'd have known about the good effects of coffee when I was in college and medical school. I never really drank it until about, probably 10 or 15 years ago. And by the way, I've learned to drink it black. I used to put stuff in it, but, which was terrible. And when I got into intermittent fasting, I really learned that when you put cream or even half and half, or all the rich creamy fats that are good for you, like MCT oil and all that, butter, which I used to do, if you're trying to stay lean, that's really an inhibitor of that, because you want your body burning its own fat. So black coffee and water for breakfast instead of any breakfast is a way to maintain that intermittent fasting, which now I do almost every day, and I've never been leaner. You combine intermittent fasting with a low carbohydrate diet, then you're going to be lean. It's the best way to keep weight off. Getting your weight loss may take some help from guys like us, but maintaining it, you need to remember those two things. Now, when you think fatty liver, you don't get it by eating fat. You get it more by eating sugar and unprocessed or highly processed carbs and bad fats. Good fats do not cause fatty liver or high cholesterol or anything like that. That's been a miscalculation for many years, but now all the experts know that the good fats are actually good for you and don't clog your arteries. The way your liver starts out getting cirrhosis and scarring is really, it starts out with inflammation, the root cause of all disease. Then it progresses to scarring and fibrosis, and then cirrhosis, which means your liver functions just terrible. So you're going to feel bad all the time. You're not going to metabolize. You're going to get obese. Your abdomen's going to protrude. You're going to get extra fluid on it. It's a terrible thing to watch in patients, I can tell you that right now. But I'm real pumped up about the fact that coffee, which has so many other beneficial benefits, I think if I'd have drank it in medical school, I'd have probably been near to the top of my class instead of the middle of my class. At least that's what I tell myself. But anyway, coffee also has been, which is one of the richest antioxidants they are. They reverse that free radical damage that your body just accumulates by living. So if you want to live a long time, you're probably going to drink coffee. We know it reduces the incidence of Alzheimer's disease, which is particularly important for women, because 2/3 of people that get Alzheimer's are women. It's more of a woman's disease than a man's. The other thing that decreases is Parkinson's disease. Coffee helps you lose weight. It decreases colon cancer, even helps erectile dysfunction. It also reduces the incidence and helps treatment of type 2 diabetes, which is usually associated with obesity. So you need to drink coffee. I didn't initially like the taste of coffee, but I've grown to kind of get used to it. It's kind of like a comforting drink to me. Again, I try to use a high-quality organic coffee and one that's mold-free. For some people that can't tolerate the acidic flavor of it, you can add just a little pinch of baking soda that will help. But I strongly encourage you to learn how to drink black coffee. It'll increase your longevity and increase your quality of life. So think about fatty liver and think about the beneficial effects of coffee. Thanks. I'll see you again next week.